What is a good AMH level to get pregnant? The answer here is that there's no right answer. You could have an AMH that is undetectable and get pregnant within the first month of trying. Or you could have an AMH of 9.0 and try for a year and still find yourself needing to meet with a fertility specialist, do a full evaluation, and explore different fertility treatment options. It is important to know the AMH before you start on the fertility journey, because AMH will tell you a little bit about the fertility runway and how long it is. How much time do we have before the egg reserve starts being low and fertility treatments will start being inefficient? But just because an AMH is very low does not mean that you will have infertility or that you will not be able to conceive naturally. So what is a normal range of AMH? It really has to be taken in the context of the woman's age. So AMH as a test is measured, at least in the United States, in nanogram per deciliter. In some other foreign countries, you'll see it in nanomoles per liter. So it's important to know, if I'm seeing a patient from overseas, I have to see what the units of measurement are, because there is a conversion. But if we're talking about US measurements, less than 0.16 is considered undetectable. AMH cannot be detected in that patient's blood. There are some assays that go lower to even 0.03 as the lower limit of the assay. And then most assays over 23 is considered above the limit of the assay. So there's so much AMH that it's somewhere beyond 23, but 23 is the reported result. As a general rule of thumb, if I'm seeing a patient where the AMH is over 3 nanograms per ml, that patient has good ovarian reserve. Maybe a 23-year-old could theoretically in the future have low ovarian reserve, but over 3, I'm not really worried. Under 3, there's a lot of nuance, and it really depends on the patient's age. So if I'm seeing a 23-year-old patient with an AMH of 2.2, her egg reserve could be okay. It also could be low for her age, and we have to see kind of how the next several years go. If I'm seeing a 41-year-old with an AMH of 2.2, that patient has rock star ovarian reserve. She has extremely high ovarian reserve for her age. And so the result really needs to be taken into context. An AMH of 0.9 in a 36-year-old is pretty low. An AMH of 0.9 in a 44-year-old is excellent. And so, unfortunately, a lot of primary care physicians and obstetricians and gynecologists are just looking at the reference ranges on the report from whatever facility did the AMH assay and seeing if the result falls within the reported normal range. But that reported normal range is too wide to actually give the patient a sense of where she falls in her fertility journey as it relates to her egg reserve. And that's why it's very important to partner with a fertility specialist who has a nuanced understanding of how to interpret the AMH in the context of the patient's fertility goals.